Hello, everyone. Thank you for the opportunity to tell you about a transformative project that has taken shape in the small, yet critically important healthcare sector of organ donation and transplantation. In today's presentation, I'm delighted to be joined by my InfoWay colleague and project partner, Jeff Green. The story that Jeff and I will share with you is how provincial and federal governments, pan-Canadian health organizations, and the broader ODT community have come together to tackle challenges that are shared in common and to drive towards improving the patient journey for both organ donation and transplantation. Our story today is in 4 parts. First, we'll share with you the many challenges that exist in the ODT sector. Then we'll tell you about the national collaborative that has served to bring together stakeholders from across Canada to focus on a handful of key initiatives, including the project that Jeff and I are involved with. In the 3rd and 4th part, we'll share with you the future state vision for this country in the ODT sector and the approach and progress that is underway. So what are some of those challenges that are faced by ODT operators in Canada? The most obvious challenge is that there is a much higher demand for solid organs for transplantation than that are available for transplantation. In fact, over 4,000 Canadians in 2020 waited for an organ, and fewer than 2,700 received a transplantation. This gap exists year over year, and in some instances, it grows. Sadly, 200 people will die waiting for an organ transplant. When we look beyond Canada, we can see that we underperform other developed nations on a range of performance measures related to organ donation and transplantation, including living and deceased organ donation and wait times for transplantation. The people that work in this sector are also in want of high quality and timely data that can inform them on how their organizations are performing over time, including how outcomes are experienced by transplant recipients. And depending on where you live in Canada, your experience can be vastly different than those living in another jurisdiction. As these data illustrate, the rate of donation per million population ranges from a low of 12.4 in Manitoba to a high of 26.1 in Ontario in the year 2019. This chart also illustrates the material and sustained increases in donation rates in a couple of Canada's largest jurisdictions in 2016 and 2017. And while many of Canada's provinces undertook several focused practice changes, it was BC and Ontario that implemented a deceased donation management solution, which helped them realize a range of benefits, including the ability to audit records and target improvements across their referral hospital networks. Yet we are still in this deficit, this supply exceeding demand for donated organs. We have not yet achieved equilibrium in this country. So what are some of the challenges? We've undertaken a strategic review of all of the operators in Canada, and it's become clear to us that healthcare sectors have underinvested in modernizing their ODT operations through the use of enabling technologies. And it's understandable why this might be the case, because volumes are quite low. So some of the most sophisticated procedures that are performed by the most highly skilled surgeons and clinical teams is really held together by old technology. And what we mean by that is the use of phone, fax, email support many of the business processes and the communication processes. And where there is the use of technology, what we've found is that there's very little systems integration in place, which means these teams have to revert back to the use of old technology and other modalities to move patient information amongst themselves. So a highly interdependent ecosystem that manages organ donation and transplantation is really focused on paper, fax, and emails. And of course, in turn, it means that performance improvements are not easily achieve because data is not readily available, it can't be easily analyzed, and in turn, it can stall improvements and contain innovation. As the old adage goes, if you can't measure it, you can't manage it. So it was no surprise that the ODT Collaborative, in its seminal report published in 2018, really felt that a lack of a national database and reporting service was the Achilles heel of the sector. So we just want to tell you briefly about the Organ Donation and Transplantation Collaborative. The collaborative itself is a 5-year initiative. It's led by Health Canada together with the provinces and territories, the Canadian Blood Services, and importantly, the involvement of patients, families, clinicians, and researchers. In total, Health Canada is funding approximately 11 projects as part of the collaborative. These projects are focused on the potential of improving ODT services in Canada, including governance, interprovincial organ sharing, improvements in donor identification and referral, patient engagement, and others. The project that Jeff and I are involved in, the Pan-Canadian Data Management and Reporting Service project, is among the largest of the 11 projects, spanning 5 years with a budget in excess of $40 million. And we're not doing this alone. We couldn't do this alone. This is really about convening, facilitating, and moving together. A large part of our role is stakeholder engagement. And we oftentimes will bring people together for very specific and focused activities. And on the right side of this slide, you'll see some of those activities. Both CIHI and Infoway have designed an inclusive approach to engagement. Subject matter experts are recruited from across Canada, and they serve on expert advisory forums. Some of the work that is undertaken relates to data management, identifying data elements that can support indicators and reporting. And of course, from the perspective of Infoway and our specific role and accountability, we bring together subject matter experts to help define solution requirements that in turn can lead to solutions that can be deployed in this country. On the left side of the chart is really our accountability through to the Conference of Deputy Ministers. The ODTC, the collaborative in short, is involved in those 11 projects. And each of those projects have a stream of activity relating into an advisor group. In our case, the Data System Working Group relates into a coordinating committee. There's an overarching steering committee responsible for governance of all of those projects, including the Pan-Canadian Data and Reporting Project. And ultimately, on an annual basis, we report into the Conference of Federal, Provincial, and Territorial Deputy Ministers of Health, who approve our plans and commit to moving forward. We also are funded directly by Health Canada and have an obligation to continuously put forward plans and action reports against those plans on a regular cadence. So I'm now going to ask Jeff Green to walk us through the final 2 chapters of our story. Jeff?
Great. Thanks, Mark, and thanks everyone for attending our session today. As Mark alluded to, our project is being co-led by ourselves at Infoway and our partners at the Canadian Institute for Health Information. This has been a very productive partnership, and the scope of the project is very well aligned with our 2 organizations' areas of expertise. The slide we're showing here speaks to the objectives of the project overall and what it will achieve. CIHI is leading the work that is focused on the data and reporting aspects of the project. So implementing data standards and a common minimum data set for organ donation organizations and transplant centers, developing a Pan-Canadian data repository to store the ODT data, defining the indicators and measures that will be used to monitor and improve the quality and performance of our ODT system. And they will work on the preparation and publication of value-add analysis and reporting, as well as providing access to ODT data for authorized users. For us at InfoWay, our role on the project is to invest in the procurement, deployment, and integration of point-of-care solutions for organ donation organizations and for transplant centers. So these are the solutions being used on the ground to collect and submit the data that CIHI will house in its repository. Our work includes extensive collaboration with stakeholders from all participating jurisdictions to define common solution requirements, as well as supporting the management and implementation of solutions across the country. So at the end of this project, we intend to have all provinces across the country using modern organ donation management solutions, and to have significantly increased the number of transplant centers using modern solutions as well. So the previous slide, we talked about the deliverables that our project will achieve. This slide really speaks to the why. Why are we doing this, and how will it improve ODT system performance in Canada? And the answer is really to address the challenges that Mark spoke to in his opening slides, such as improving donor volumes and increasing the number of organs that are utilized for transplantation, which will thereby increase the number of transplants performed overall. We also aim to decrease variation in donation rates across jurisdictions and realize efficiencies in the care that's provided. In the long term, this will lead to equitable access to high quality transplantation, and will work towards meeting that gap that Mark spoke to in the demand and availability of organs. And lastly, the realization of ongoing cost savings. So how are we going to get there? We start to speak to that in the next few slides here. So this slide shows our long-term future state data model. It's obviously very detailed and the font is way too small for us to go through this in a lot of detail, but we wanted to include it to show the ODT data continuum and to show that our province is aiming to modernize the core systems and include some high-value integrations among those systems, but we're not covering everything, and there's still going to be a long way to go to achieve a truly seamless ODT landscape. Very quickly though, from InfoWay's perspective, our focus is on the blue box within this diagram here, the ODT data management systems, and in particular focused on solutions on the deceased donation management side of that equation, as well as the transplantation and living donation management solutions as well. Those systems will include some integrations that I'll speak to in an upcoming slide, but including integration into what is this green box here, the CIHI focus of our project, the ODT data repository and the reporting and data access piece of it. So data flows from the point of care solutions into the ODT repository, analysis and reporting structures are put in place and provided to stakeholders, as well as providing access to data for authorized users. So our first priority from the start of this project has been to support the implementation of a deceased donation management solution. As you may know, organ donation is coordinated at a provincial level by organ donation organizations, or ODOs. In larger provinces, these are agencies such as Trillium Gift of Life in Ontario or BC Transplant in British Columbia. And in smaller provinces, they may be run through the Ministry of Health or within a hospital program. But regardless, these organizations use some form of DDM solution to manage the collection and flow of data across the organ donation journey. For the purpose of our project and defining the scope of data to be collected, we did go through a collaborative effort with our stakeholders to define that journey overall. And you can see on this slide that our starting point is really the referral of a potential donor. And then following that through to consent to donate organs. Once that consent is approved, managing the donor overall, and that includes allocating organs and matching them to transplant recipients and providing that offer, the retrieval of organs overall, and then following through with utilization and clinical follow-up and follow-up with the donor's family. So that's really the spread of data that we are focused on for our solution deployment. Users of the system will be a broad range of clinicians, IT staff, management within the ODOs themselves. And from the technology perspective, we've been very focused on cloud-based technologies, software as a service, as well as taking a buy, not build approach. We are very focused on commercially available solutions that we can leverage. So with this slide, we start to get into how we're actually going to achieve the deployment of these solutions. So for deceased donation management, we initiate the process with procurement of a vendor's application. This is work that we've been focused on for the last year or so, and I'm happy to report that we're nearing completion of the procurement. We're actually right in the middle of evaluations of responses to an RFP right now, and aim to have the selection of a successful bidder by the end of this calendar year. From there, we will move into deployment of the solutions, hoping to initiate our first deployment before the end of this fiscal year, and then staggered deployments across jurisdictions in the next couple of years, with an aim to be complete by the end of fiscal year 2023-24. Among the value that we've been able to provide to this process has really been the facilitation of a multi-jurisdictional deployment that's included definition of common solution requirements with extensive input from our representatives from all of the stakeholders. So the previous slide focused on the approach for jurisdictions that do not currently have a solution in place. The three largest provinces in Canada, BC, Ontario, and Quebec, do have a modern solution that they are using for deceased donation management already. So it hasn't been necessary for their inclusion in that process. But we have been able to leverage that and focus on early work related to integration of solutions within these three provinces. And there are three areas that we've been focused on for that. One is around integration across the jurisdictions to enable sharing of organs across provinces. And we will be also focused on integrations into the CIHI data repository, as well as to the Canadian Transplant Registry, which is managed by the Canadian Blood Services Organization. The next phase of our project, as we complete work on the deceased donation management side, will be to facilitate deployment and integration of transplantation and living donation data management solutions across the country. Our process for this work began this summer with a discovery phase where we met with representatives from transplant centers across the country to understand their current state, their priority issues, and their ideas for modernization. Through this process, we defined the scope of the transplant journey and the living donor journey, as you can see on the slide here. Not surprisingly, we found that there's a great deal of heterogeneity in the solutions being used by transplant centers. Transplantation and living donation are hospital-based programs, and lots of hospitals use different underlying information systems with different levels of maturity. So there's definitely a lot of variation in readiness. As a result, we anticipate that transplantation sites will fit into one of three implementation categories. Working left to right on the slide here, the first category is transplant centers that already have an existing modern solution for managing their data. Obviously, there won't be a need to replace those solutions. So we'll be focused, similar to our work on the deceased donation management side, on integration of those existing solutions so that their data flows seamlessly into the CaiHi data repository. The next category, sort of at the opposite end of that spectrum, is transplant centers that are still using antiquated technologies, a lot of paper-based work in their workflow. So looking to deploy net new solutions to those centers, and based on available funding and timing, we anticipate that we will be able to deploy solutions to up to 7 centers in this position. Lastly, recognizing that we may not be able to deploy to every transplant center that needs a solution, as well as recognizing that some centers have quite low volumes and the cost benefit of a major solution deployment may not be there. There will be a web form approach that is available for submission of data to the CaiHi repository. So I'll quickly go through the next slides just to discuss how we intend to move forward with these activities. Quite similar to our efforts on the deceased donation management side, for the net new deployments, we will be defining solution requirements in a collaborative effort with our stakeholders as a preparation for solution procurements. Those procurements we aim to initiate in the second quarter of next year, fiscal 22-23, and then we'll move forward to the deployments I was referencing at up to 7 transplant centers, and those deployments may start as early as the last quarter of next year. And then moving forward with integrations in order to get the data into the CaiHi repository. And those activities will need to be completed by the end of fiscal 23-24. Where modern solutions already exist in transplant centers, we obviously don't need to procure new solutions, so we'll be focused just on those integration activities and starting those at an earlier point, and again, hoping to leverage the experiences there so that we can use them in the process for net new deployments of solutions. So I know I went very quickly through those. Hopefully it gives you a sense of the activities that we're focused on as we move forward. In closing, we just want to say that this has been a very exciting and rewarding project to be a part of. We really believe it's going to have a big impact on the ODT environment in Canada. It's a big investment, over $40 million provided by Health Canada, and that's a big deal for a small program like organ donation and transplantation. And that funding is going to greatly improve workflow efficiencies at the point of care, as well as the quality of data and our ability to use that data in a meaningful way to spur on improvements in organ donation rates and transplant recipient outcomes. So we're really proud to be a part of this work. And you can visit our websites at either Infoway or CaiHi to learn more about this initiative. And you can also feel free to reach out to us at our email addresses that we've shown on the slide here. So thank you very much for your time. We hope you learned more about our project, and enjoy the rest of the conference.